Hello, police.
I'm sorry if I seem uninterested or I'm not listening or I'm in.
Today, we student nurses of Colegio San Agustin Bacolod will talk about antisocial personality disorder.
We are surrounded by people with different personalities, and sometimes these personalities became a barrier for misunderstanding and miscommunication.
Everyone feels the antisocial sometimes, but people with antisocial personality disorder had an almost impossible time respecting or connecting with other people.
Antisocial personality disorder is a psychiatric condition in which a person manipulates, exploits, or violates the rights of others. One of the biggest signs of antisocial personality disorder is a pervasive disregard for right and wrong of society's norms.
So let's discuss antisocial personality disorder.
Antisocial personality disorder, sometimes called sociopathy, is a mental condition in which a person constantly shows no regard for right and wrong and ignores the rights and feelings of others. People with antisocial personality disorder tend to antagonize, manipulate, or treat others harshly or with callous indifference. They show no guilt or remorse with their behavior. So we have here a personality screening test. This is a test to determine whether you are susceptible to antisocial personality disorder. This test is answerable by yes or no. In general, do you have difficulty in making and keeping friends? Would you normally describe yourself as a loner? In general, do you trust other people? Do you normally lose your temper easily? Are you normally an impulsive, short-of-term person? Are you normally a worrier? In general, do you depend on others a lot? In general, are you a perfectionist? Individuals with this disorder would answer yes to the red questions.
Signs and symptoms of antisocial personality disorder are disregard for right and wrong, persistent lying or deceit to exploit others, being callous, cynical, and disrespectful of others, using charm or wit to manipulate others for personal gain or personal pleasure, arrogance, a sense of superiority, and being extremely opinionated, recurring problems with the law, including criminal behavior, repeatedly violating the rights of others through intimidation and dishonesty, impulsiveness or failure to plan ahead, hostility, significant irritability, agitation, aggression, or violence, lack of empathy for others and lack of remorse about harming others, unnecessary risk-taking or dangerous behavior with no regard for the safety of self or others, poor or abusive relationships, failure to consider the negative consequences of behavior or learn from them, being consistently irresponsible and repeatedly failing to fulfill work or financial obligations.
As such, people with antisocial personality disorder often engage in criminal activity resulting in frequent running with the law. A person with antisocial personality disorder often lies, causes fights with others, and steals. Another facet of antisocial personality disorder is a blatant disregard for the rights and feelings of other people, which often manifests not only as lies but as deceit, often coupled with intimidation of others. Violent and aggressive behavior is typical. Often, a person with this disorder does not show guilt for their actions.
Adults with antisocial personality disorder typically show the symptoms of conduct disorder before the age of 15. Signs and symptoms of conduct disorder include serious persistent behavior, problems such as aggression toward people and animal, destruction of property, deceitfulness, theft, serious violation of rules. Complications can include imprisonment and drug abuse. An antisocial personality disorder can also often come hand in hand with other impulse control problems like chronic gambling. Additionally, people with this illness often have additional mood disorders related to depression and anxiety.
Antisocial personality disorder is one of the most difficult personality disorders to treat. There are certain factors that increase the risk of developing antisocial personality disorders, such as diagnosis of childhood conduct disorder, family history of antisocial personality disorder or other personality disorders or mental illness, being subjected to abuse or neglect during childhood, unstable, violent, or chaotic family life during childhood. People with this condition rarely seek treatment on their own. They may only start therapy when required by the court.
The effectiveness of treating antisocial personality disorder is not known, and in order to make accurate diagnosis, psychiatrists use specific identifying guidelines for antisocial personality disorder.
It is difficult for antisocial personality disorder clients to progress in treatment. Avoid having excessive expectation of improvement. Focus on the practical skills such as teaching appropriate and effective coping strategies. Aside from possessing blatant disregard for the rights and feelings of others, a person cannot be diagnosed with antisocial personality disorder unless he or she is at least 18 years of age and has demonstrated symptoms of conduct disorder like stealing or violence before age of 15. Even once diagnosed, it can be difficult to treat antisocial personality disorder. This is largely because, by definition, people with the illness do not care that they are causing pain and problems.
Yeah, we need a fire engine. Yeah, there's a fire. There's a fire just down there beside the golf course. Yeah. Yeah, okay. Yeah, please be there soon. Yeah.
If a person is willing to receive treatment, it usually comes in a form of psychotherapy or talk therapy. Occasionally, medications may be prescribed to treat certain symptoms of the condition, such as depression or mood instability. In some cases, hospitalization in a mental facility or incarceration in a prison is necessary treatment steps.
If you think you or your loved one is affected by antisocial personality disorder, please make an appointment to see a mental health professional. Last but not the least, protect yourself. Mental health workers by nature often tend to give clients the benefit of the doubt. This leads to downplaying the serious problems of the antisocial clients. Clinicians who have an extraordinary need to be all effective and all giving by easily manipulated by ASPD clients into an ending battle. At times, they may even end up unwittingly colluding with the clients, minimizing their pathology in order to make sense of the situation, and as a result, blaming themselves for being ineffective and inadequate.
Thank you for watching, and we hope that you learned something from us. Once again, we are the student nurses of Colegio San Agustin Bacolod.
I'm sorry if I seem uninterested or I'm not listening or I'm